Thank you very much for being here. Just a few days ago on Monday, the Aspen Institute has celebrated its 10th anniversary in Romania. And it was quite a lovely event. It was a gala at the National Art Museum with friends, with partners, with members, with alumni of our leadership and policy programs. But what set it aside from our usual annual galas is that this time we've announced two new programs, one dedicated to arts and society in partnership with the National Art Museum and a number of other institutions, festivals that operate in the Romanian arts and culture field, but also one dedicated to sports and society, looking at, in partnership with the Romanian Olympic Committee. Now, as is the case with those two programs that we launched this past Monday, today we gathered to kick off officially this time what we call the Aspen Life Lab. Now, my role here is mainly to brief you on what is this, why is this, and what we want to achieve by creating the Aspen Life Lab, both we, the Aspen Institute, and the partners coming together in supporting this initiative. We've been doing policy convening for the past 10 years on all host of issues, from foreign policy to security to economics to financing the economy to the future of work to technology to cyber issues, you name it, we've done it. Quite often, the halls of the Romanian Parliament gathered some of our international conferences on the topics. Some of you, many of you in fact, attended some of these events. What we've learned throughout these 10 years is that if we are to achieve lasting, sustainable, persistent policy effects, meaning to use the huge platform of competence, expertise, willingness to look into how to improve policy, both from the private sector, public sector, expert sector, think tanks, academia, you need to have a more permanent setting than just a conference every 6 months or once a year or every 2 years. That it's not enough to talk about those things. You need to put data, you need to put concrete proposal, you need to test those proposals with various audiences, and in fact you need a permanent community to work on those issues. And we realized we have that community. We've been doing, for example, when it comes to healthcare and quality of life issues, we've been doing for over 6 years specialized events in that field. In energy, the same thing. For the past 6 or 7 years, we've done systematically annual conferences covering those. So we've gathered a number of Romanian, foreign, European experts of all sorts, those that are either directly related to setting policies for those domains or are the receiving end, consumers, you name it. So at the beginning of last year, we started thinking, planning forward for the 10th anniversary, what are the additions to our policy work and what form do these additions need to take in order to maximize both these communities that the Aspen Institute in Romania and the network of the Aspen Institutes in Europe has access to, but also to address specific priority needs in this Romanian society. And we eventually concluded that there are 3 areas where we have this mix of both available expertise, know-how, and a priority set of needs. One is energy. Energy and sustainability, so the continuum between environment and energy generation, energy consumption, energy transport. And earlier this year, we've launched the Aspen Energy Lab. Then the second program that we've thought it's a must-do in terms of intervention in the policy sector is urban development and community development. So this year includes, just a couple of months ago, we've launched officially our Aspen City Lab. And today, we're convened here well, we started yesterday, but we convened here in an open format, in a public format, to launch Aspen Life Lab that focuses on healthcare and quality of life issues. The reason I'm putting this in context, and thank you for letting me take these 5 minutes to explain why and how those interrelate, is that we see this as a very long-term, a permanent process that doesn't address one issue or a limited set of issues one time and then it moves on and does something else. But it aims to persistently work on, first, the quality of the process generating new thinking about public policy and public policy implementation in key areas. That cannot be done in 2 months, in 6 months. It needs to be a continuous process. So we launched these 3 policy labs without an expiry date, but we also realized that you need to have very concrete achievables in order for your partners, for your public, for your partners, your experts to feel that there is a contribution, that at the end of the day that work is not theoretical, doesn't remain in folders like these, and actually gets to audiences, like the wider audiences. In this case, it's maybe not by chance that we gathered in the Romanian Parliament for this conversation, just at the moment when a new parliament was elected, a new government is coming in, and we have hopefully 4 years of working with officials, both elected and appointed, in critical areas for Romania's development. Now, to focus a little bit of what we aim with the Aspen Life Lab. Few areas show more governance, conceptual, and practical vulnerabilities as does healthcare when it comes to Romania. Romania is a middle-income country, member of the European Union and NATO in Europe. So technically, if you look at it from a distance and without knowing the reality of the country, it checks the boxes, and your expectation is that the quality of life, the quality of healthcare services and access to medical services, pharmaceutical procedures should be somehow European average. Well, it is not. And we all know the main reasons for this. There's some things that the Aspen Life Lab or the Aspen Institutes or all of us cannot address like this. But there are areas where net improvements can be achieved relatively quickly with effective policy intervention. And that's where we started. We gathered quite a significant group of experts in the field, practitioners, people that work in the medical sector, so medical professionals, but also policymakers, patients' organizations, young leaders in those fields. And before even setting up an agenda, we convened them a few times to see what are the priorities. And we created a list of about 7 areas, and I think they're in the folders in the presentation of the Aspen Life Lab, that cover a full spectrum of what is considered priorities, from mental health to oncological problems, from access to innovative medical solutions, both when it comes to pharmaceuticals and when it comes to procedures, improvement in access to both geographically and socially to quality care, etc. We won't be able to work on all those at the same time. So we do have a sense of priorities, and we do have 2 or 3 topics that we're already working on. As you know from our prior launches, we don't usually launch a project when we have a piece of paper and a few ideas. We always do this by having worked on the issues, having come to some conclusions, having some proof of method by the time we come to the audience, to the media, and to the specialized publics. So when it comes to Aspen Life Lab, for the past over a year, but more concretely in the past 6 months, first together with our experts, and in the past few months with foreign experts, we've worked on a couple of specific projects mixing research, data number crunching, and fresh policy thinking to address some of the key vulnerabilities. One of those is how does the Romanian system approach innovative medicine, as I mentioned earlier. How do you ensure that your citizens, that the customers for your healthcare services, so from a business perspective, again, those that tap into the services, and from a citizenship perspective, those that are entitled to the principles of universal care granted by the Romanian constitutions, do actually get that service. And in particular, do get access to what is today shaping the medical sector. And we quickly realized from the experience of our Bucharest Forum Healthcare and our conferences in the field that if we are to expect one thing in the coming years, is an acceleration of the effects that innovative healthcare is going to have on healthcare outcomes. And that the countries that adapt their policy systems to this avalanche of new technologies, new pharmaceutical and procedural solutions will be at an advantage when it comes to giving their citizens or their customers a better care, with better healthcare outcomes when it comes to quality of life, quality of experience throughout the medical system, and ultimately, the key measurements that are important, morbidity rate and life expectancy. So what we've done is selected a few cases that are testbed cases, where innovative medicine has come to provide key solutions that can be radically transformative for the quality of life and medical outcome expectancy for both the medical professionals and their patients. I'm not going to get into the nitty-gritty details because we have panels to discuss that, but just a couple of words on the method and this is going to be true for all the projects that we put under the aegis of the Aspen Life Lab. The way we imagine this is that we have a series of layers interoperating. At the core of it is expertise, both Romanian and foreign. And we really are privileged to having had, throughout the years, created a series of networks of contacts that allow us to tap into some of the best minds in Romania and abroad with expertise on this sector. And thank you again for those of you that are going to be on the stage in the next panels for supporting us in this respect. The next layer is practitioners in the field, people that work in Romanian hospitals, primary care physicians, medical experts, public health experts, people that deliver care. The next layer is policymakers, is politicians, officials in the various Romanian national or local institutions that are responsible of generating, testing, implementing policy. Ideally also improving policy. And finally, there's an outer layer of partners and young, what we call emerging leaders in this field. These include medical professionals, graduate students, people that work in these institutions, but also in non-profit organizations, in non-governmental organizations that are key elements of the various medical fields that we cover through throughout the program. The scope of it all is to not only create data sets and paper solutions for what is ideal in that respect in the Romanian context, given Romanian budgets, a profile of patients, and if you want, epidemiological or medical data. But rather to create a whole sounding board that allows the experts, decision makers, and the entire community that we built into the Aspen Life Lab to have really serious conversations on what is applicable, what's the right timing, How do you go about creating audiences for subjects that sometimes are below the threshold of public attention, though they're critical and have significant either budgetary or quality of life effect in Romania? And finally, how do you go about of making those decisions and transforming them in actual policy decision, and then follow it through? Not just stop when the decision is taken, fine, but actually looking back at how that worked, how is that implemented, what can be changed, what needs to be changed in order for that to perform. And then take the lessons in that project or one specific project and see what applies for other healthcare areas, creating, if you want, equally an avalanche of policy solution that may have eventually transformative effects on how Romanian healthcare sector works. Now, one thing that we are aware of is that for most Romanians, whether they admit it or not, this is often number one priority. If you talk to Romanians that, for example, they choose to emigrate, to live abroad, quite often, the first reason that they give, whether it's true or not, but that's what their subjective opinion is that they're looking for better healthcare, better education. That ties also into how much do we pay the medical system? What's the budget allotment to medical system? Now, in that area, the Aspen Institute has, and its partners in the Aspen Life Lab, has a limited say. It's up to political parties, the parliament, the citizens to decide what's the best way to approach Romanian healthcare spending. But what we can do is actually work on how effectively what we have is spent, how the correlation between spending and healthcare results can be measured. And ultimately, that's the role of these, of our session and of our work. For the past couple of days, we worked together, Romanian and foreign experts, on one of these subjects, and you'll hear a little bit more from the real experts. And whenever I'm in this setting, I do feel what is called how do you call it in English? That you're, in a community of experts and suddenly you find yourself totally out of your depth. And despite my, now more than 3 years of working on these issues, I'm always overwhelmed by the wealth of expertise, pointed questions, specific, always snap-on comments that you hear from both your Romanian and foreign partners. And I realized that no matter how much we work on these things, it's never enough. But again, thank you very much for being here. It really is a privilege to having worked with many of you over these past years, and particularly these past few months, and as you'll hear, with already significant results.